Talk about the vascular supply to the arm, forearm, and hand. And as we do, we're going to answer a few questions like what arteries supply the arm, forearm, and hand? What boundary marks the transition of the axillary artery to the brachial artery? And how can we identify the arteries of the hand on angiograms? Just like we started the scapular supply with a diagram, we're going to start this video with a diagram as well. So we'll write out the word heart. We'll just say that's our heart there that we're starting with. And then we'll draw our aorta with the aortic arch. Draw an A for the aorta. And then on the left side here, we have the left common carotid and the left subclavian that come directly off the aortic arch. Since the aortic arch is on the left side, to get to the right, we have one extra step. So we have this brachiocephalic artery that's saying it's going to go to the brachium, to the arm or the upper limb, and the head with the cephalic. And then from there, we're going to have the right common carotid and then the right subclavian. And just as a quick review for the upper limb, we know off of this right subclavian, we have a vertebral artery that's going to go to the brain. We have an internal thoracic that's supplying the anterior chest. And then we talked about we have this thyrocervical trunk right here. So off of the thyrocervical trunk, there is a suprascapular artery. And then we also have a transverse cervical artery that has two branches, a dorsal scapular artery, and then a superficial branch of that transverse cervical that's going to go to the trapezius. Those are some of the main branches of the subclavian artery. And then we know once the subclavian artery is going to swing down, it will hit the first rib. Then once it passes the first rib, it's going to switch names and become the axillary artery. And so some of the branches off the axillary, we have a supreme thoracic, we have a thoracoacromial trunk with a pectoral, acromial, I'm running out of space here, clavicular and deltoid branch. And then there is a lateral thoracic artery, and then I'll make it a little bit longer. We'll see if we don't run out of space here. And then following that, we're going to have a subscapular artery. So we saw a suprascapular, now a subscapular. And then off of the subscapular, there's going to be a circumflex scapular artery and a thoracodorsal artery. And then to finish up the axillary artery, there is the posterior circumflex humeral and the anterior circumflex humeral. The posterior circumflex humeral artery, that goes through the quadrangular space with the axillary nerve. So we've got that. And then the axillary artery, it continues inferiorly. And once it crosses the inferior border of teres major, still one continuous two, but it's now in a different region. It's in the brachium. And so we're going to call that the brachial artery right there. Off of the brachial artery, we're going to see a branch called the profunda brachial artery, or the deep artery of the arm. It gets that name because it hops off posteriorly, goes with the radial nerve through that triangular interval, and then it goes into the posterior brachium. So again, the profunda brachial artery, or profunda brachii artery, you'll see it both. So we've got that right there. And then the brachial artery, it's eventually going to go to the forearm. Once it's in the forearm, it's going to split into two different branches. There's going to be an ulnar branch right here, and then the second one, also named based off the bone it's near, is going to be the radial artery. So we've got an ulnar and a radial artery. The ulnar artery is going to have interosseous branches that come off, so there will be a common interosseous artery, and then an anterior interosseous artery, as well as a posterior interosseous artery. So those, we learned there's an anterior interosseous nerve, it's a branch of the median nerve. We also have an anterior and a posterior interosseous artery or arteries there. And maybe to label those, we'll switch to black to label. We'll just do anterior interosseous artery. And then the radial and ulnar arteries will continue into the hand. This is where we're a little tight on space, but I think we're going to make it. And so we're going to see off of the ulnar artery, there's going to be a superficial arch right here. So we're going to call this the superficial palmar arch. And off of that arch, we're going to see these guys right here, and that's going to be a common palmar digital artery. And then from common, whenever we see that word in anatomy, it just means it's going to split, but then keep the same name. So if we have a common palmar digital, that means it's going to split. And then these guys right here are just going to be called palmar digital arteries right there. So we've got those, but this arch is kind of ending weird. Arches usually don't end. So what we're actually going to see is from the radial artery here, that arch is going to continue. So we're going to see that as an example of collateral circulation. And then if we have a superficial palmar arch, that probably means we're going to have a deep palmar arch. And so that comes off of the radial artery right here. So we'll call that the deep palmar arch. And off of that deep palmar arch from the radial artery, and maybe I'm going to just kind of draw it out here so we can differentiate. Off of that deep palmar arch, we're going to have an artery that goes to the thumb, and it's the chief artery of the thumb. So we give it kind of a funny name. It is the, maybe we'll draw it, we're running out of space, we'll go over here. The princeps pollicis artery. Princeps just means like chief or foundational, so it's the main artery to the thumb, so we call it the princeps pollicis artery. It's a little far away, so we'll give it a little line. And then the other branch we're going to see off of this radial portion of the deep palmar arch is the radialis indicis artery. So that's going to go to the index finger. And again, that's the radialis indicis artery right there. And that is it for our diagram. So we got a quick review of the axillary as well as the subclavian branches of subclavian axillary, and then some of these branches that are going to the arm, forearm, and hand. So now we're going to switch to the actual images from the atlas so we can get a better idea. But again, I know I said this in previous videos, drawing arteries and veins, great way to learn them. So here is our image from the atlas. And just to review, we have the aortic arch here, the brachiocephalic artery, subclavian, once we cross that rib, axillary, and then once axillary right here, maybe we'll throw out a label axillary. That now about here, it looks like it's more in the arm than in the axilla or the armpit. So we're gonna call that the brachial artery here. And again, that dividing line is the inferior border of teres major, which it's not on this picture, but it'd be about that area. And then from the brachial artery, we said that's usually more in the anterior compartment, the anterior brachial compartment. So there's a profunda brachii artery, or this deep artery of the arm that's going to go to the posterior compartment. Now getting a little bit more of an inferior view, again, we can see the brachial artery here, a little bit more anterior. We still see the profunda brachii artery, again, going to that triangular interval wrapping around the radial groove with that radial nerve. And then off of the brachial artery, we see as we follow it down, it ends up splitting into two. So we get this split into the radial artery, and then a split into the ulnar artery. And those are going to supply the forearm. One other note I wanted to make here, you can see from the radial and ulnar and the brachial and the profunda brachii, there's all these recurrent and collateral branches. I'm not going to have you learn these, but I just wanted to make you aware that there are some collateral branches in this area. Now moving to the forearm, we're still seeing the radial artery right here, and then the ulnar artery, and then this would be that common interosseous artery with a posterior interosseous and then an anterior interosseous here. Then as we continue to follow the ulnar artery down, we're now seeing these palmar arches. So we'll get this image here to see that a little bit with a bigger view. And so we've got, again, the radial artery here, ulnar artery away from the thumb. As we follow the ulnar artery, we see the superficial palmar branch, and that's eventually going to continue and meet with the radial artery. And then off of the superficial palmar branch, we have these common palmar digital arteries. We see the name common, it means it's going to split, so there's the split there, and we're going to keep that palmar digital artery name right there. And then off of the radial artery, you can see in this space, we're kind of in the area of the anatomical snuff box, and then it's going to loop around and have this deep palmar arch, which will meet up with the ulnar artery. Off of that arch, we have the chief, or the foundational artery for the thumb, the princeps pollicis artery right here. And then we also have that radialis indicis artery going to the index finger, or this second digit. Now to finish up our practice, we're going to do the same thing with the hand, but now we're going to do it on this angiogram. And this angiogram, I know it's a little bit faint, but it's of the left hand, so we're going to be flipping everything. So we've got the thumb right here, then digit 2, 3, 4, 5, continue over. So to start, we've got the radial artery right here swinging down. Off of the radial artery, we have the deep palmar arch. And then also we're going to see the princeps pollicis artery here, and then the radialis indicis artery here going to the index finger. And then if that's the radial artery, that means this right here would be the ulnar artery with the superficial palmar arch. We don't quite see it connecting perfectly here in this image. We've got the superficial palmar arch with common palmar digital arteries that will then split into just palmar digital arteries. Those are all the images we have, so now let's do a quick review. We learned the brachial artery supplies the muscles in the anterior brachial compartment. Off of the brachial artery, we have the profunda brachii, or the deep artery of the arm, supplying the posterior brachium. Then the radial artery in the forearm is supplying primarily the muscles on the radial side of both the anterior and posterior antebrachium. The ulnar artery is supplying muscles mainly on the ulnar side of the anterior and posterior antebrachium. But with those anterior and posterior interossei arteries, we will see the ulnar artery kind of sneak in a little bit more into the middle of the compartment. And then finally in the hand, we saw those superficial and deep palmar arches. We saw those common and palmar digital arteries. And then for the thumb, the princeps pollicis artery. And that is it for this video on the vascular supply to the arm, forearm, and hand.